Good morning, all. I am Dr. Mallik. People call me Dr. Mallik, and I have done my MBBS from Gandhi Medical College, Hyderabad, and later I completed my diploma anesthesia and critical care diploma in Gandhi Medical College only, and later I have been to Osmania to continue my MD anesthesia critical care, same subject. MD diploma is 2 years and MD is 3 years. Later I went on to do my MD anesthesia critical care in Osmania. I finished that. After that, I have been in Hyderabad for nearly so many years, for 10 years, and I have been practicing both critical care and anesthesia. And I worked in Care Hospital, Apollo Hospital, some of the corporate hospitals, and later I had been to Saudi Arabia for a couple of years. Again, there also I was a consultant anesthesiologist and critical care specialist. So after that, I have been to actually Amalapuram, Konasima, East Godavari district in Andhra Pradesh. Amalapuram is my native place, and for the last 20 years after working in Saudi Arabia, I came to Amalapuram. For the last 20 years I have settled in Amalapuram, and I am the chief anesthesiologist and chief of ICU critical care unit and emergency wards and all. So for the last 20 years I am working here. Okay, and most of the people have doubts, what is anesthesia? Actually, what is anesthesia? Because I share a small joke with you. One of my cousins, he got married during my MD days, when I was doing my MD, my postgraduate. So he wanted to introduce his wife to my family. He came to me. So the moment he introduced me to his wife, saying that, yeah, he's my cousin, Dr. Mallik. He's an anesthetist. Immediately his wife said, yes, I know what is anesthesia. She was saying, okay, I was just listening to her. She said, during surgeries, during any operation, if suddenly the patient vomits, the doctor there catches the vomitus in a tray, and he wipes out the face and all, he cleans up. He's the anesthetist, I know. So I was a little bit stunned for a while for her knowledge. But whatever it is, she's a lay. Of course, they are laymen. They understand in a different way. So I asked her, how do you know that? Madam, how do you know that? She said, my sister underwent cesarean section in so-and-so hospital, and she had a vomiting. One of the doctors there immediately, the doctor who was standing at the head end, he immediately caught the vomitus, and he wiped out everything, and he made her comfortable and kept her oxygen. Okay, fine. That is her experience, her sister's experience. That's one. Most of the people, even a couple of years back, used to ask me, sir, for anesthesia, what do you do? Do you fix a dose for every case, give the injection and go? So this is what people have. Even some people ask me, do you give a tablet, particular tablet for a particular surgery? This is what people used to ask me. Anyhow, luckily, after around 3 years back, after this corona, most of the COVID episode, most of the people knew what is anesthetist, because then people came. See, elite people and educated people know what is anesthesia very well. So anesthesia not only involves operation theaters and different types of anesthesia for different cases, and it is not just giving anesthesia and going home. No, it is we come before the surgery. Before surgeon comes, we take care of the patient. We judge the patient. That's called pre-anesthetic checkup, and we give the anesthesia that is required for that particular patient, because there are different types of anesthesia, different regional anesthesia, general anesthesia, and various types. For each disease, for each style, we have a different type of anesthesia, and we stay till the surgery is over, and then we ship the patient to the ICU or surgical ICU, then stabilize the patient, and even 24 hours, next 24 hours, we'll be in touch with the patient, we'll be taking care of the patient. And anyhow, apart from that, we work in intensive care units, that is critical care medicine, especially when the patient is grossly sick, and ventilatory management, putting the patient on ventilators. And not only that, even every patient doesn't need ventilator. Even then the anesthetist will be there to take care of them. And particularly ventilatory management and what you call is advanced life support. Basic life support and advanced life support is given by mostly anesthesiologists in association with other specialists like medicine, chest physicians, etc., etc. This is all the thing. So recently, why? This is my first video. Recently, I completed my 60th year. I have completed 60 years, and there will be a celebration called Sastipurti. I had done it at Varanasi, was the place where the ritual went on. And after that, I seriously started thinking, why not I share my experiences with all of you? Not only sharing my experiences, because we have gone through quite a lengthy procedure, nearly 40 years in medical career, with different problems. And not only sharing my experiences, in coming videos, I will start sharing on each disease and each problem, what are all the treatments, what are all the things we can do, and what are the latest things. And I have this is a big hospital, 100-bedded hospital. I have surgeons, I have cardiologists, I have general medicine people, pediatricians, gastroenterologists, neurophysicians, neurosurgeons, all the faculties. So I want to also make them part of this. They will also give you proper guidance, and we will talk on different topics in the same scenario, in the same platform. And we'll make almost, I will try to be very regular in videos, almost every video or 1 or 2 videos a day. Good topics. And I also request all of you to please below in the videos, below comments, you please you can ask me various doubts, or your problems, your family problems, your relatives problems. You can put in this, and I will share my WhatsApp number also in the coming few videos. In the maybe 1 or 2 videos, I will share my WhatsApp number also. You can just frankly ask me anything, whether it is personal or professional or anything related to medicine. I will try to answer you everything. Not only me, I will try to make my specialists also to answer you all the questions and till your satisfaction. You can just keep on asking me. No doubt, I have already crossed 60, and I am not free. I am working around the clock in this hospital, but definitely I will try to spend much time in videos. And one more thing is, especially I wanted to share you a small thing which happened to me recently. 3 years back, when the COVID has stricken, that's COVID crisis, our hospital was also a COVID center. And we have been treating, particularly, as a critical care specialist, as an anesthetist. I was chief of the operations. I was chief of the COVID here. So we have been treating hundreds of patients. Ventilators were continuously working, and patients really heartfelt things. Every patient, even today I remember. every patient who passed away or who was treated and went home. I just remember because they are not, it's not easy to forget them. And during this 1-2 years, a couple of months in 1920 and a couple of months in 1921, so I have picked up nearly about, see, I was usually 81, 82 kgs. At the age of 60, 80, 81 kgs, always it was my regular weight. And during this period, during this COVID period, my weight went on to 96. I didn't notice it. I mean, I have been noticing, but the only problem is because of continuous work where I was not bothered much. I was just going on, okay, dekh lenge baad mein, let us see later. So one fine day, previously I used to check my sugar levels, BP, etc., etc. I was a hypertensive, I was a diabetic, but on medication. So when I checked once after this COVID, immediately after the COVID, second attack, so second episode, 21. So in spite of the weight, my sugar levels were high. Fasting was around 290, post-lunch was around 370, and I was surprised. It never happened to me. I was on medication regularly, and I am a person who does regularly exercise also, but because of COVID and that busy schedule, the exercise was also literally alternate days or every third day I used to do little less. And maybe these are all the factors, and maybe I have had COVID also, we don't know. Sometimes it passes off slightly with small cold, etc. We don't know, we don't get checked. And my sugar levels have gone up, and I have become hypothyroid. Thyroid was positive. And one more thing is my BP is 170, 100 and 160, 100. It was never like that. I had to take 4 tablets to control my BP. To get back my, per day, I was using 4 tablets to get back my BP to 130/80 or 130/90. So this was the guy. Then I took it little seriously, and nearly for about 3 to 4 months, in 6 months, in a period of 6 months, with change of diet. It is only diet, exercise, and some medication. Mainly they say 80% is diet, 20%, in any case it is 80% is diet, 20% is exercise, and rest of it is medical care. I mean, medical care, whatever it is, investigations or treatment or whatever it is. So I just took care. I went through various modes of diet, and I have fixed myself a particular diet, and I have surprisingly within 6 months, my sugars have become just normal. Even HbA1c level has come to 6.5, and blood pressures, in spite of previously 4 tablets I used to use, now I am using only 1 tablet, and thyroid just vanished. No thyroid medication at all. So this is all. This is hypertension, diabetes, thyroid, and weight gain to 96 kg. I was 81, I went to 96. Now I am 76 or 77 recently when I checked. So this is all, they come as a package. This is also called metabolic syndrome, as you all know. So this is all I wanted to tell you about, and this is only my first video. Please take it, and from my next video onwards, I will try to take all your comments, reply on it, and not only that, I will try to give you very good information along with my specialists on particular topics, and I will try to have interviews on this platform with all my specialists. Particularly if you want to have any doubts cleared with one of our specialists, you can definitely get it done. Just put the comments in the comment section, just write it. I am there to answer it. Thank you for patiently listening to me. Once again, thanks.